A dental implant is a titanium screw which is inserted into the jawbone. It takes several months for the implant to fuse with the jaw. Once it's welded in place, then it's time to attach a crown or other prosthetic components to the implant. By using implants, single or multiple, you can restore patients' chewing ability who otherwise would be without teeth. There are various reasons why people will need a dental implant. Some people are simply losing one tooth and they want to get that one tooth replaced. Other people have been scared to go to the dentist and they've slowly lost teeth and over the years have functioned, and then they get to a point where they just can't chew. And in those patients, they may need multiple implants, and by doing that, we're able to reestablish teeth that have been missing for many years.
When a patient is referred for dental implant treatment, well, you normally have them come for a consultation, and they meet our implant treatment coordinator who can discuss with them all the intricacies of dental implant treatment. Usually the patient has lots of questions about the concept of treatment, how long it takes, how much it costs, how's the process work, what's my dentist going to do, how they're going to be involved. And so that conversation is very helpful with our implant treatment coordinator. I will then examine the patient, look at their radiographs, discuss their treatment needs, and from there we'll make a plan on how to move forward.
In a typical dental implant treatment process, we have the patient come on an empty stomach, have a driver with them so that we can administer IV anesthesia. Once the patient's asleep, we open the gum tissue, place the implant or multiple implants if indicated, and then we place a component on top of the implant, and then that component goes through the gum tissue. The gum tissue is sutured closed with resorbable or dissolvable sutures. Over the next couple of weeks, the sutures go away, and then we typically see the patient back 2 weeks later to obtain an x-ray and make sure that everything's healing properly.
Depending on the treatment a patient has, the recovery process is pretty simple. A single molar implant is no big deal. Go back to work the next day.
When you're recovering from the surgery, you are usually asleep in our office for your procedure, so you wake up, and as you're waking up, we allow your family to come back and be with you during the wake-up portion of the post-operative period.
One thing that's very important in the post-operative period for most patients is to know that they do not have to go without teeth. And so we're accustomed to making sure that every patient has a acceptable provisional restoration they can wear. That's my number one question I ask is, how long will I be without teeth? We ensure that you do not have to go without some sort of restoration, walk around without teeth. So don't worry, you won't be walking around without teeth during the healing process.
Once you're stable and ready to go home, then you will be driven home by the person that comes with you. Typically people do need pain medicine for the first day or two after the surgery. Then they can transition to less strong pain medication, and typically the surgeries that we perform don't require a prolonged pain control regimen.